Yes, I am Dr. Abdulameer Abu Nailah. I am a specialist rheumatologist. I am working in Canadian Specialist Hospital. Today is World Arthritis Day. I want to take the opportunity to talk about a disease called rheumatoid arthritis. Rheumatoid arthritis is a chronic inflammatory disease that affects the small joint and big joint of the people. It's a common about 1 to 2% of the people. Usually, it affects the adults between 20 to 50 years old, but it also affects the people more than 50, for more than 50s, and also affect the children. The cause till now is unknown, but most probably is related to our immune system. Family history is very important, and sometimes risk factor is also very important. We need to, for example, to stop smoking in patient if he is smoke. Second things, the symptom of the patient usually complaining from pain and swelling and stiffness of small joints of both hands and feet, and also affect the knees and both hips and shoulder. Sometimes also the patient complaining from fever, weight loss, and even sometimes lead to fatigue and morning stiffness. How you diagnose this disease? The diagnosis is very important, because when we diagnose this disease early and start early, we preserve the function of the joint. We prevent the deformity of the joint. Usually the diagnosis is the patient need to go to the doctor specialized in this field, which called rheumatologist, which is specialized in this field. And we need to do, at first we take information from the patient, and then clinical examination, and sometimes we need to do some blood test. Simple, very simple blood test. The result will finish within 1 to 2 hours, not more. Sometimes we need to do some X-ray, or even sometime bedside ultrasound. The treatment of this disease is easy. There is many options for treatment. We need to start at first from disease by non-steroidal anti-inflammatory drugs, which called painkiller. It's very important to take because it decreases the pain. Also need to start a disease called DMARD. DMARD is very important medicine. This medicine, it prevent or slow the progression of the disease. It's prevent the joint. When we start early by this medicine, which is good for the patient. Also, there is now a new medicine called biological therapy. Biological therapy in form of the injection. A simple injection like the insulin under the skin. Some injection once a week, some medicine every other week, and also another medicine every month. It's very simple and it's very safe. There is no side effect for this medicine, but it's important to stop the disease. Also, it's very important to the patient to become healthy, to take good amount of milk. It's very important also to do a regular exercise. If there is no pain and swelling, we need to advise the patient to do at least 30 minutes, 5 times a day, a week. And also, if the patient of obese need to decrease the weight, also need to take good amount of milk. It's very important to make the bone strong and prevent the sequelae of the disease.